Before you agree to your next surgery, stop. Because right now, in hospitals across this country, seniors are signing consent forms for operations they don't fully understand, operations that, in many cases, they didn't even need to have right away. I'm not saying surgery is bad. Surgery saves lives every single day. But there are 7 specific situations where I've watched patients good, trusting patients say yes too quickly. And some of them are still paying the price for that decision. One of those patients was a woman I'll simply call Dorothy. She was 74, sharp as a tack, still driving herself to church every Sunday. 6 months after her surgery, she couldn't drive anymore. Her family didn't understand what happened. By the end of this video, you will. So stay with me, because surgery number 4 on this list is the one almost nobody sees coming, and it's probably the most common one on this entire video. Hi, I'm Dr. Alex Mandell, and if this is your first time here, welcome. This channel is for you, your parents, or anyone you love who's navigating what it means to get older and stay independent. I want to be very clear about something before we go any further. I am not anti-surgery. I am not telling you to walk out of your doctor's office and refuse treatment. What I am telling you is this. The decision to have surgery after age 65 is different than it was at 35. Your body recovers differently, anesthesia affects your brain differently, and the risks that seem small on paper can feel very large in real life. So today we're going through 7 types of surgery where I always tell my patients, and I tell my own mother the same thing: slow down, ask more questions, and get a second opinion before you sign anything. And before we get into surgery number 1, I want you to do something for me. If you've ever felt rushed by a doctor or pressured to make a big medical decision in a 5-minute appointment, put a yes in the comments right now. I read every single one, and I think you're going to be surprised how many people feel exactly the same way you do. Also, hit that subscribe button and turn on notifications. Every week, I break down real medical decisions in plain English, no jargon, no scare tactics, just what I'd want my own family to know. Let's get into it. Let's start with one of the most overused surgeries in America for people over 65, spinal fusion for ordinary lower back pain. Here's what spinal fusion actually is. In simple terms, a surgeon connects 2 or more bones in your spine together so they can't move against each other anymore. Sometimes that's absolutely necessary. If you have a broken vertebra, a slipped disc pressing on a nerve, or an unstable spine, fusion can be life-changing. But here's the part most seniors are never told. For ordinary, everyday lower back pain, the kind caused by wear and tear, research has repeatedly shown that fusion surgery works no better than physical therapy and targeted exercise for most patients. I remember speaking with a 72-year-old patient who I'll refer to as Robert. Robert had lived with a stiff, achy lower back for years. It wasn't stopping him from gardening or picking up his grandkids. It was just uncomfortable. A surgeon recommended fusion. Robert trusted him completely. He thought, well, if the doctor says I need it, I need it. What happened next surprised his entire family. The surgery went well on paper. But Robert spent 4 months in pain that was worse than before the operation. His daughter told me he stopped going on his morning walks. He stopped feeling like himself. And that's the part I need you to really hear. The goal was never just to fix a scan. The goal was to keep Robert active and independent. Somewhere along the way, that got lost. Here's a myth versus fact moment for you, because I think this trips up more seniors than almost anything else on this list. Myth: if a scan shows wear and tear on your spine, that means surgery will fix your pain. Fact: studies show that spine scans in people over 60 almost always show some wear and tear, even in people who have 0 back pain at all. A scan finding doesn't automatically mean surgery is the answer. So what should you actually do if a surgeon recommends spinal fusion for ordinary back pain? Ask this exact question: what happens if I try 6 more weeks of physical therapy first? If the answer is dismissive, that's information too. But spinal fusion isn't even the riskiest surgery on this list. Surgery number 2 involves your heart, and it's one where timing can matter more than the procedure itself. Quick reminder before we continue: if you're finding this helpful, tap that like button right now. It genuinely helps this information reach more seniors and families who need to hear it. Okay, let's keep going. This next one surprises people every time I explain it, because most of us assume anything involving the heart must be done immediately. Here's the simple version. A stent is a tiny tube doctors place inside a blood vessel to help hold it open. If you're having a heart attack, a stent can be life-saving, no debate there. It needs to happen fast. But there's a different, much more common situation. A senior gets a routine scan, doctors find a narrowed artery, but there's no heart attack happening and no chest pain at rest. In that specific situation, stable, non-emergency artery narrowing major research trials have found that for many patients, medication and lifestyle changes work just as well as an immediate stent for preventing future heart attacks or extending life. I had a patient I'll simply call Margaret. Margaret was 79, and during a routine checkup, a scan showed a narrowed artery. No symptoms, no pain. She felt completely normal. She was told she needed a stent placed right away. She thought it was just a simple minor procedure, the kind you do and go home the same day. She didn't realize that any procedure on the heart carries real risks in someone her age, including bleeding and in rare cases, damage to the artery itself. Her son noticed something was changing after the procedure. Margaret, who used to walk 2 miles with her neighbor every morning, suddenly seemed anxious about her own heart in a way she never had before. The procedure hadn't just changed her artery, it had changed how safe she felt in her own body. Here's a warning sign I want every one of you to remember. If you're told you need an urgent procedure but you have 0 symptoms, that is exactly the moment to ask for a second opinion. Not because the first doctor is wrong, but because this is a decision, not an emergency, and decisions deserve time. Now, I want to pause here and ask you something directly. Have you or someone you love ever felt pressured into a yes during a doctor's appointment because you didn't want to seem difficult? Tell me in the comments, because surgery number 3 is exactly about that feeling, and it involves one of the most common operations for people over 65. Joint replacement surgery has genuinely changed millions of lives. I want to say that clearly before I explain the danger here, because I don't want anyone walking away from this video afraid of a surgery that could actually give them their independence back. The problem isn't the surgery itself. The problem is skipping one critical step, a frailty and anesthesia risk evaluation before agreeing to a date. In plain terms, frailty means how resilient your body currently is, not your age on paper, but how well your body can handle the physical stress of surgery and recovery. 2 78-year-olds can have completely different frailty levels, and that matters enormously for how surgery goes. I remember a 76-year-old patient I'll refer to as Helen. Helen had painful knees for years and finally decided to move forward with a full knee replacement. She was excited. She wanted to keep up with her grandchildren at the lake house that summer. Nobody had assessed her nutrition, her muscle strength, or her overall frailty before scheduling the operation. She thought it was normal aging to feel a little weak beforehand, but that weakness was actually a warning sign her surgical team missed. After surgery, Helen developed something called postoperative delirium, sudden temporary confusion that's actually one of the most common complications after major surgery in older adults. Her daughter walked into the hospital room, and for a moment her own mother didn't recognize her. It resolved over time, but it terrified the entire family, and it extended Helen's hospital stay by nearly 2 weeks. This is where I want to give you something you can actually use. Before any joint replacement, ask your surgical team directly, has anyone assessed my frailty and my risk for post-surgical confusion? If the honest answer is no, you have every right to request what's called a preoperative geriatric assessment before you commit to a date. That single question, the one about confusion after surgery, connects directly to surgery number 4. And this is the one I mentioned at the very beginning, the one almost nobody sees coming. If this is resonating with you, hit subscribe now, because we've got 3 more surgeries to cover. And honestly, the next one is the story I think about the most. Here's the surgery decision that changed Dorothy's life, the woman I mentioned at the beginning of this video. Sometimes, to save time or reduce the number of hospital visits, surgeons will suggest combining 2 major procedures into a single, longer operation. Maybe it's a hip replacement combined with another orthopedic repair. Maybe it's 2 abdominal procedures done back to back. On paper, it sounds efficient, 1 recovery instead of 2. But here's what most people are never told. The total time spent under anesthesia is one of the strongest predictors of complications in older adults, including confusion, blood clots, and slower recovery. A longer combined surgery isn't simply more of the same. It's a meaningfully different level of risk. I had a patient I'll simply call Dorothy. She was 74, still driving herself to church every Sunday, still fiercely independent. She agreed to have 2 procedures combined into 1 longer surgery because it meant getting it all over with at once. What happened next surprised her entire family. Dorothy came through the surgery itself just fine, but her recovery was nothing like anyone expected. The extended time under anesthesia left her with weeks of exhaustion and mental fog far beyond what a single shorter procedure would have caused. 6 months later, she still hadn't gotten back behind the wheel. Her children had to reorganize their entire schedules just to get her to appointments. Most seniors completely miss this point. Shorter, separate procedures, even if it means 2 recoveries instead of 1, are very often the safer path for someone over 70. It's not about avoiding surgery. It's about not letting convenience quietly become the deciding factor. So here's your practical takeaway. If a doctor proposes combining procedures, ask this exact question. What does the research say about combined versus separate procedures for someone my age? A good surgeon will welcome that question, not avoid it. Now let's talk about a surgery that's often done simply because something was found, even when it was never actually causing a problem. This one catches families completely off guard because it usually starts with a totally unrelated scan. Let's say a senior goes in for an abdominal scan for something else entirely, maybe a kidney issue, maybe a routine check. The scan comes back and almost as a footnote mentions gallstones. No pain, no fever, no symptoms at all. This is incredibly common. Gallstones show up on a large percentage of scans in older adults who have never had a single symptom. I had a patient I'll simply call Frank. Frank was 81, sharp, still doing his own yard work. A scan for back pain found gallstones as an unrelated finding. He was told it might be safer to just take the gallbladder out now while we're already looking at it. He thought it was a small routine decision, one more box to check. What Frank didn't realize is that surgery on a gallbladder with 0 symptoms carries real anesthesia and recovery risk for a problem that in many cases may never cause trouble at all. Frank went ahead with the surgery. He developed a post-surgical infection that kept him in the hospital far longer than expected, and it took him nearly 3 months to feel like himself again, all for a gallbladder that had never once caused him pain. Here's a myth versus fact for you. Myth: if something is found on a scan, it needs to be removed. Fact: for many incidental findings with no symptoms, especially in older adults, careful monitoring is a completely reasonable and evidence-supported choice. Found does not automatically mean dangerous. The question to ask here is simple. Am I having any symptoms from this at all, and what happens if we just watch it? Now, surgery number 6 is one that affects men specifically, and it's tied to a type of overtreatment that even many doctors are now speaking out against. Real quick, if you have a parent or spouse who's facing a surgery decision right now, share this video with them. It might be the most useful 5 minutes you send them this year. Okay, let's keep going. This next situation is one that major cancer organizations have actually been raising awareness about for years, and it still catches families by surprise. Prostate cancer in many older men grows extremely slowly, so slowly that a man may live his entire natural life without it ever causing symptoms or spreading. This is genuinely one of the reasons doctors developed an approach called active surveillance, regular monitoring, instead of immediate surgery for cancers identified as low risk. I had a patient I'll simply call Walter. Walter was 77 when a routine screening found low-risk prostate cancer. His first instinct, and I understand this completely, was cancer means cut it out immediately. He scheduled surgery within the month. His children noticed something was changing after the recovery. Walter, who had always been fiercely private and independent, became withdrawn about a side effect he was too embarrassed to discuss with his own family. The surgery affected his bladder control, something that can happen with this type of procedure. He thought it was just something he had to quietly live with. Here's what I wish someone had walked Walter through beforehand. For many men his age with low-risk, slow-growing prostate cancer, active surveillance carries survival outcomes that are comparable to immediate surgery without the same risk to quality of life. That doesn't mean surveillance is right for everyone. It means it deserves a real conversation, not an automatic assumption. The question to ask: is this considered low risk? And would active surveillance be a medically reasonable option for someone my age? We've made it through 6. Number 7 is one that ties every single lesson in this video together, and it's the one I most want you to remember. This last one isn't a specific body part or a specific procedure. It's a pattern, and once you see it, you'll notice it everywhere. It's agreeing to any major surgery without a real conversation about what you actually want your life to look like afterward. I remember speaking with a 72-year-old patient who I'll refer to as Eleanor. Eleanor had a serious health condition, and surgery was presented to her as simply the next step. Nobody sat down and asked her the most important question of all. Eleanor, what matters most to you right now? Is it living as long as possible, no matter the cost? Or is it staying independent enough to still bake with your granddaughter every Sunday? Those are two very different goals, and they can lead to two very different medical decisions, both completely reasonable, depending entirely on what matters to the person living that life. Eleanor chose surgery without ever being asked that question. The operation was, medically speaking, a technical success, but her recovery left her needing full-time care, something she had spent her whole life saying she never wanted. Her family loved her deeply, and they did everything right, but the conversation that could have changed the outcome never happened because nobody thought to have it. This is, without question, the most important thing in this entire video. Before any major surgery, insist on a direct conversation about your goals, not just your diagnosis. Ask your doctor plainly, based on my goals, is this operation actually going to get me there, or is there another path? That single conversation is the difference between medicine that serves you and medicine that simply happens to you. Before we wrap up, I want to leave you with something concrete, 5 questions I genuinely encourage every one of my patients over 65 to ask before agreeing to any major surgery. 1. What happens if I wait or try a non-surgical option first? 2. Has my frailty and anesthesia risk actually been assessed, not assumed? 3. What does the research say for someone my specific age and health situation? 4. What is the realistic recovery timeline, including confusion, fatigue, and mobility? 5. How does this decision line up with what actually matters most to me? Write those 5 questions down. Bring them to your next appointment. A good doctor will never be offended by them. They will welcome them. Here's what I want you to walk away with today. Surgery isn't the enemy. Rushed decisions are the enemy. Every single story I shared with you today, Robert, Margaret, Helen, Dorothy, Frank, Walter, and Eleanor, none of them had a bad doctor. What they had was a decision made too quickly, without the full picture. You deserve time, you deserve questions, you deserve a real conversation about what your life should look like on the other side of that operating room. If someone you love is facing a big surgery decision right now, a parent, a spouse, even yourself, I want you to send them this video today. Not next week, today. Because the best time to ask these questions is before you're lying on that operating table, not after. If this video helped you, please like it, share it with your family, and subscribe to this channel. Every week, I'm here breaking down real medical decisions in plain language because you and the people you love deserve to walk into every appointment informed, calm, and in control. I'm Dr. Alex Mandell. Take care of yourselves, and I'll see you in the next one.